Now I would request Dr. Rati Godrej to speak.
Thank you so much. It's such a pleasure and privilege to be here for something that is so dear to my heart, both personally and professionally. Personally, of course, I grew up in the US where we used to walk to school and walk to university and walk to the local pharmacy. And then coming here, you realize that's just such a difficult and challenging task. And secondly, of course, the laws of driving were also a huge change for safety. And so, yes, we definitely need to improve both the transportation, the road safety, as well as for pedestrians. I grew up in a place where pedestrian rights were first. Whatever the pedestrian did, you protected them. And I think we need to bring that mentality back to people because we want more and more pedestrians to feel safe and comfortable. But as a doctor and a professional working in medicine and public health, I feel the most important thing we need to do is make people aware of what walking can do. If I gave you a magic pill or a prescription that could bring down diabetes, control your blood pressure, reduce your risk of cancer, improve your osteoporosis condition, improve your well-being, improve your mental health, mood disorders, depression, you'd say, yes, please, where can I get it? Well, you can get it by walking. And it's simple and it doesn't cost anything. So this is what we need to focus on. And we need to also realize that even cancer, for women who walk, the risk of breast cancer is so much less, by 15% if they walk 7 hours a week. So those are the kinds of things we need to make people aware. We also know that people get sick less often if they walk regularly, even for 20 minutes a day. They take less time off from work and their immunity is even better. So they get sick less often. So the advantages are so numerous and extensive. We need to bring this to public health. And so, yes, we definitely want to make our sidewalks to be clean, smooth, and definitely give people access to their local schools or temples to be able to walk there. Does it really make sense to get into a car, go to a gym, take an elevator up, go to the 16th floor, work out on a treadmill, come back down, go into the car and come home? When if you have a safe space to walk around your home, you get much, much more benefit, as well as vitamin D, which is so important that we're all lacking, I think, when we check our blood reports. So let's encourage people to walk more and have a safer, cleaner environment for them to walk. So this is very, very important, and I give you my full support in whatever way we can to support these walking project. Thank you so much for having me.
Thank you, Dr. Ratiji.